taking you on a tour at Park Place Junior Dental Office.
Hi, my name is Alicia. I'm a dental hygienist at Park Place Junior.
Okay, and today we're taking the tour of the office and learning about some dental care so we can keep our teeth nice and shiny and have a great smile and have the teeth do all the functions that they need to do.
So as soon as you guys come into the office, the operatory, you guys are gonna have a seat. Nice and clean hands. We put on our gloves. Open the trays. Everything is nice and clean, sterile. So for example, this is a polisher. We use this little tool here to polish the teeth. It's like a brush. We like to call it like an electric toothbrush for the dental office. This is how it works. Yeah, because it does actually work like a toothbrush. So when we set it up, it looks just like this. It's a little bit loud. It kind of shakes and rumbles, just so they feel that, you know, it's nice and soft. Yeah, of course.
Ooh, and it's rotating and it tickles.
It tickles a little. We use it with a special little toothpaste. Just brush your teeth with it in circular motion.
Now turning it in the circular motion is a force going onto the teeth, and if there's something stuck on the teeth, the force is trying to push the plaque or the dirt off your teeth, the food, to get it off, okay? So we're trying in a few STEM concepts here along with our healthy living.
We have a little mouth mirror, so it fits in everyone's mouth, so that it allows us to see, because sometimes inside your mouth it's a little bit dark. It's like a little cave. So we need our mirror, we need our special light. Sometimes we call this little tool here a tooth counter, and it's our little scraper to clean all the plaque off your teeth. This guy here, we call it Mr. Thirsty. It looks like a straw, and when we hook it up to the other side, it's like a vacuum, like a water vacuum. So when in your mouth there is water or your own saliva or spit, then we turn it on, it sucks it all out. Makes this kind of sound. And then when you touch it, it's like a little suction. Right.
Now, why do you have sunglasses here?
Oh, sunglasses, because we need to protect our eyes. First of all, we don't want anything to go in our eyes. It's for safety mainly, and also because this light, this flashlight here that we have is super bright. We have to wear a bib just to keep our shirts nice and clean. So we just hug it up like this with a little clips, and then it goes just like this in the chest. If you want to rinse with water, and then you want to spit rinse your mouth, then you can use this little bowl right beside you. Machine is like a camera. We use it to take x-rays, little pictures of your teeth. And always we have to wear a protective apron. It's a lead apron to protect our body from radiation.
Sometimes you need to take the x-ray because the dentist or hygienist cannot see, like, when you're actually looking in your mouth, they have to see underneath the gums. You need to take the x-ray, you have to bite on something so they can take the x-ray.
Yeah, we bite in a little plasticky thing. So don't have any sugar bugs or cavities growing. And then the dentist will look at these x-rays and determine that if everything is okay or if we need to get a little filling. So that vent was created for COVID, to maximize and to make the air in the room more efficient, more safe. To keep our teeth nice and clean and healthy and strong, we need to do a couple things. A brush twice a day, every morning and every night for 2 minutes each time. And we like to floss at night, especially. And floss would get rid of all the plaque and the food that gets stuck in between the teeth, something that the toothbrush won't be able to. Don't forget also to brush the tongue. We're gonna give it a quick brush, quick scrape, not too hard, but we need to make sure the tongue is also clean because it harbors bacteria as well. If you notice your tongue is a little bit whitish, like coated, that means that needs to be brushed. The way we brush our teeth is we go in the up and down motion. We need to make sure we get all the teeth one by one. You can also do circular motion, nice and soft, but make sure you cover the whole tooth from the gums to the bottom of the tooth. Okay, this will like sweeping motion, or you can do circular motion as well. Children have 20 teeth.
Now my student Cooper, he had a question for you asking, why do baby teeth grow and then they fall out and big teeth come in, the adult teeth come in?
As we're growing, then our mouth also grows, so now we need more teeth. And the way that happens is like baby teeth, the roots of the baby teeth, they start getting shorter and shorter and shorter. Then they fall out and the adult tooth is ready to come in. We have different teeth in our mouth. They have different functions. bigger teeth, which they're called molars. Here we have 2 molars, and then we have the little ones that they're still like middle sized. They're called premolars. Very important to keep this area also clean, not just brush the outside and the inside, but also this surface here collects a lot of food. When we eat, everything gets packed in these grooves here, right? So if we don't keep them clean, then we can also get cavities. Canines are the pointy ones, right? They're right at the corner of the mouth. So we have 4 canines, 1, 2, 3, and 4. And then we have the incisors, okay? Front teeth. We have 4, 4 in the bottom, and then 4 in the top. And so here, this is an adult's mouth. Wisdom teeth is a 3rd set of molars that come later on, like usually 18 to 20. Here we have the roof of the mouth. Inside of the mouth, like the tongue, the cheeks, the gums, everything is like soft, right? So we have to be very careful, very gentle when we brush them. But yeah, some brushes come with like a little soft side on the side, so you can use this side of the brush.
You clean your toothbrush when you're done.
That's right.
Because there's lots of germs on it.
Yeah, we have to make sure we rinse it, we tap it just to get rid of the water.
Some of the younger students might not know what dental floss is. Are you able to show us, please?
It's like a thin thread, so we use it to clean in between our teeth. So we wind it in our fingers until we have this about this much in between the fingers. And we go up and down in between the teeth, and then when you go down, you curve it a little bit, okay? You go against the tooth and then against to the other side, okay? And then we come up. We just go like this, down, and then it's like a seesaw motion all the way down, because you don't want to go too hard down because you're going to hurt your gums right here, right? So you're going to go like a seesaw motion until you get to the bottom, back and forth until you get to the bottom, and then you go to one side and to the other side. We have these little ones too. The handle, it's much easier sometimes to get in the mouth, right? For little kids, and also for parents who are helping the kids. So pretty much the same thing. We're just gonna go in between the teeth, back and forth until we get to the bottom, and then we come out. The only thing with this little guy is that because it's such a small piece of floss here, we either have to wipe it or rinse it under water and then go to the next tooth.
Plaque is what we do not want on the teeth, so that's what we're cleaning off.
Some cavities, they are small. Some cavities are a little bit bigger. So if the cavity is still small, so with proper oral hygiene, with proper diet, right, with proper care at home, that cavity might not grow. If the cavity is a little bit larger, then the dentist will use a needle with an anesthetic to make the area, the tooth numb, so you don't feel a thing. So
I know for when I was small and had to get the needle, I felt a slight little pinch, just so you're aware, but the dentist and the hygienist, squeezed my hand, and then it was just quick, so then I could get the procedure done, because if you leave the cavity, it can cause a lot of pain.
Laughing gas, we use it often here, and it's to make the kids more relaxed. Makes the experience more comfortable for them for the procedure. So it's like a little nose cone. It's like a little gas that you breathe in, and that makes you more relaxed. You're still awake. If it is a little bit larger and it needs to be cleaned out and get fixed, then the dentists, they just drill a little hole. They just clean out the sugar bag, right, with a special tool, and then they put like a putty, like a special putty that gets hard. So then that acts like a part of the tooth. We remove where the cavity is, where the sugar bag is, and we put this little putty, like white, like colored, tooth color putty, and then we make it hard, so it looks like a tooth. Most offices are doing white fillings. The silver fillings are metal, they're mercury, but also they're cups, like they're silver cups that go over top of the tooth, and that's stainless steel. So there are different materials, different ways that the dentist use to fix teeth, depending on what the problem is.
So for students that want to become a dental hygienist, what types of things do you have to learn at school?
The job of the teeth, how they're formed, their functions, how to take care of our teeth. So I can teach you guys how to do it, how to work with kids and adults. We need to learn about taking x-rays. Like I took math, I took I remember chemistry, I did biology.
What is the difference between the hygienist role and the dentist role?
The dentists, they fix the cavities, they restore the teeth, right? They make sure that they're functioning well. If there's a cavity, they remove it, they put a filling in it. My job is basically to clean the teeth, to teach you how to take good care of your teeth at home. We talked about nutrition, how important our diet. I do the polishing, which is like the little brushing. I take x-rays. I can also take impressions. Impressions are like little molds that we take of our teeth to make either like sports care and protect our teeth.
I remember I used to get something called the fluoride treatment.
In generally speaking, we do it every 6 months, so twice a year. And we have a mouthwash with fluoride. So we have different ways of doing fluoride. Depends on the age of the kid, and also depends on the condition of the teeth. Some kids that tend to have more cavities, they get another different form of fluoride, which is called the fluoride varnish, which is a stronger form of fluoride. And we use with a little paintbrush, we paint it on the teeth. And then this is a mouth rinse, where you have to swish for a minute and then you spit it out.
Can you tell us a few of those safety tips when brushing their teeth?
Yes, of course. So the number one rule is like they cannot spit out the toothpaste, then we have to stick with fluoride-free toothpaste because you don't want to swallow the fluoride toothpaste, right? So we gotta try to encourage and to practice the spitting. Once that's been mastered, like they make sure parents notice that they don't swallow it, that's when we switch to fluoride toothpaste. Fix, keep, maintain for as long as possible the baby teeth in the mouth until they fall out naturally. When we talk about healthy eating, we're talking about reducing or limiting sugars, juice, pop, anything that can cause the tooth to decay, right? To get a cavity. And drink lots of water after eating anything. So the water will neutralize the saliva in the mouth so the sugar doesn't stay. Right?
The saliva is your spit inside your mouth.
We like our veggies. We like to eat our veggies. Our fruits. Fruits are also healthy, but they do have natural sugar. So again, it's very important after we eat our fruits to drink water. Balanced diet in general.
Our teeth are also structures, natural structures in the body, and we are also learning about stem. Can you tell us a little bit about how the teeth stay stable in the gum area so they don't come out when we're eating, and they are able to withstand the force of all the different foods that we eat, the tearing, the chewing, and keep our teeth in the mouth?
Yes, of course. So teeth have different layers. So the outer layer that we see here, the whitish part, it's called enamel. Okay, so inside, underneath enamel, we have dentin. We have the cement. We have the nerve of the tooth, which is inside. And then underneath here, we don't see it, but the teeth have roots. Here at the bottom, we have bone, right? So these long roots, they anchor to the bone. Okay, so then that's how our teeth are super strong, because they're inside the bone, right? So then when we eat, the teeth don't fall out. Now, mind you, if you don't take care of your teeth, if you don't brush, floss, go to the dentist regularly for cleanings, then the gums and the bone become weak, and then we have some problems in that sense, right? The bone and the roots become weaker, and then we can see that they're not as stable in the mouth. Teeth are very important for eating, for chewing, for smiling. Teeth have different functions, right? So it's very important that we keep them healthy. Never go sideways. When we brush our teeth, we don't want to do this forced. We don't want to go back and forth, because that's how we are going to destroy. We're going to get rid of the gum that we need to support the teeth.
What happens to the tools after they get used?
So after we finish with the appointments, we have to clean the tray, the tools. Some tools are disposable, which means that we throw away after each use. For example, the gauze, the toothpaste, the little brush, Mr. Thirsty, go in the garbage. Our metal tools, we clean them, we sterilize them, and then we reuse them. So the instruments, when they come out of these sterilizing machines, they are nice and clean to be reused again. Totally safe. We have a solution. We have like a special water and a special liquid that kills bacteria. So we turn it on and we run it with the water, with the solution. So it suctions it, and then it cleans the whole tube.
There's another tool that I get to use at my dentist.
This is called a rubber tip. It's a nice and soft, pointy rubber, right, that we use to sometimes clean in between the teeth and also trace, like sometimes we get plaque or food stuck under the gums. So you just use it like a sweeping motion like this, nice and gentle. Don't put too much pressure. And then we go in between the teeth, in and out. And then, you know, it's just to trace, like pretend you have a pencil and you're just tracing. So you go back and forth, in between, up and down. Okay, you can do the outer surface, you can do the inside surface. This is a nice tool when you have braces too. So there's a little piece of gum sometimes covering the tooth. So what we like to do is with this tool, is nice because you can go under the gums gently. You can clean and dislodge any piece of food that gets stuck here. You don't want to keep or have any food under the gums because it can cause some discomfort, some irritation, infection sometimes. There is something called a water pick that we always recommend for kids with braces. It's like a water shooting little nozzle, like device that keeps the wires and the elastics and everything, all the orthodontics equipment nice and clean. Usually this is the best part of the appointment. All the kids look forward to this part at the end. So we let them, first of all, we let them use some hand sanitizer so they can go search in the treasure chest. We also give you guys a little bag, a little goodie bag with some dental tools and some dental stuff to take home and use. So for example, we have our toothpaste, a little cute travel toothpaste. We give you guys some floss, the one we showed you earlier. We also give you sometimes this one too to practice with the long piece, the long string, and we give you a toothbrush. This is a sun timer. It's at 1 minute on each side. So we have to brush our teeth for 2 minutes.
Empower yourself to take care of your teeth and have a great smile, and your teeth last a long time. I want to say a big thank you from my students and myself and anybody else who's watching for this amazing tour. I got some cute things too. Thank you so much very much for all the information. We appreciate it.
Thanks for the opportunity to show the kids what we do, why we do it, how important it is to come see us at the dentist. And we see you again soon.